Now, we have many other targets. So, what produces the majority of autoantibodies in lupus patients are the plasma cells. And of course, we do know how to target plasma cells. That's what we do in multiple myeloma. So, investigators in Europe have been brave enough to study bortezomib in lupus and did find efficacy. And of course, now there are newer generation drugs that target plasma cells. The reason that we haven't all jumped on board to do this is because bortezomib, for example, has major toxicity, including things like neuropathy. Now, there's a JAK inhibitor that's been successfully tested for lupus in a phase 2, and that's baricitinib. Baricitinib, of course, is already FDA approved for rheumatoid arthritis. We understand its mechanism of action. And in the phase 2 trial in lupus, it helped joints. There may not have been enough very severe skin patients to identify benefit for skin. There are some studies that are being done of new treatments for lupus that haven't reached the level of a randomized clinical trial, or not yet. And one that I think is quite interesting are mesenchymal stem cells. This has predominantly been studied in China, but there's now going to be a clinical trial in the US as well. Mesenchymal stem cells may actually help Tregs. So there may be many reasons why they could have benefit in lupus. Another fascinating approach to lupus, which again is not to immunosuppress, is the idea of using low dose interleukin 2. Low dose interleukin 2 increases Tregs. I love this idea because it would allow the immune system to police itself. Now, of course, there's a narrow window here. You don't want too much interleukin 2. So you have to be within that window. But this has been tested in investigator initiated studies in Europe and in China. Seems to have worked well with very little toxicity. So this is now going to be a focus of several pharmaceutical companies.